We have a patient who is a survivor. He is a survivor of cancer, a very rare form of brain cancer. So at the back of his head, he has these two little spots where the radiation entered his brain to kill off the tumor. Those spots are not growing hair as well as the areas around them, and they're two little ovals, so they're very distinct. He also has a little bit of a scar on this side and right up the center of the back of his head. So those areas are noticeable. What we're going to do is we're going to take hair from around those scar areas and we're going to put that healthy hair into those areas to even out the distribution of the hair at the back of his head so that he can start to walk around with more normal appearance.
My motivation is, like I said, to have an appearance looks normal and just first my own self-confidence.
Hey guys, welcome to another Bald Truth live hair transplant event. Today we have, I think it's a really special event because the surgery is being performed by IHRS Executive Member Dr. Sarah Wasserbauer. Dr. Wasserbauer, how are you today?
I'm doing great. How are you guys doing?
We can't complain. Now tell me about the patient. Tell me about, the patient situation and how you guys kind of hooked up for this pro bono procedure.
Absolutely. This is Carlos, and came to me with a story of how he had cancer, a really rare brain cancer. He was diagnosed at age 18. He was within, moments in surgery and getting radiation therapy, so his entire life changed. He survived the cancer, but he was left with two spots where the radiation beams kind of entered to kill the tumor, and then this big long scar right here. See there? It's always nice to get an opportunity like this where you can help somebody who, probably didn't think that they could do anything to help the hair. Because these areas are bare. And so what we're doing is we're taking hair from the areas of his head that were still perfectly, untouched, and we're going to fill in these little areas. The reason this one looks pink is because I've made a whole bunch of little sites where we're going to put the hair into, and the same thing with this big long scar. So that, he can just look a little bit more normal, when he goes out. He's got this circle here and this circle here and this long scar in between it. It just doesn't, doesn't feel right to him walking around. People who don't know him don't know what the heck happened to the back of his head, so.
The scarring and the appearance of the back of my head has affected me. It kind of plays with my confidence every now and then. I tell people that I know, like, if you did not know me, it kind of looks like I had a barber mess up on one of my haircuts. So.
But what are you using right now? Is that the safe system?
This is the safe system. This one just seemed, in particular, because I have to go in between this area and the scar. There's certain areas I want to take from, certain areas I don't. This system is a little bit easier for me to be more flexible about where exactly I'm taking. And plus, I can direct it a little bit better. I would like to leave his sides as intact as possible, and I'm trying to decrease the amount of density right next to the area that has little density, because I know that even though I'm putting hair in here, the density isn't going to come up to what his normal density is. His normal density is like 70 or 80 follicular units per square centimeter.
Right. And
transplanting, I won't get near that. So, bringing the density down very slightly by taking the grafts out next to it will help to even the whole thing out. And visually, that's what we're going for. So that's why I use the safe system. It's a little bit easier for me to be more flexible where exactly I needed to go.
Listen, this is a guy that's been through a lot.
Yeah.
He's been through a lot. He's willing to share his life, and he's willing to share this, which is really, to me, a really intimate moment with thousands of online viewers. And once it's on demand, it could end up being hundreds of thousands of people who are going to view this video.
Yeah,
It's pretty brave of Carlos to do this for us.
Carlos is really interested. I mean, with all the guys been through, Carlos is kind of waking up now, but he's, in and out. Really interested in paying it forward. And, making sure that people know that this can be done, whether their situation is like his, where, we've got scars from a brain tumor, or whether it's a little less, dramatic than that. I think he's really interested in helping other people to, see what's possible and make good decisions.